There's lots of different treatment options available for teens with eating disorders. There's different levels of care. Outpatient therapy, that's what we traditionally think of when people just go see an individual provider. And so you have a team of people that you still want to see because that's really important with eating disorders. So you have a outpatient therapist, outpatient nutritionist, then you're usually following up with a medical doctor, and also a psychiatrist if needed to manage some of your other symptoms, depression or anxiety that you might be having. And the next lowest level is intensive outpatient. That's where you can go to school, go to work, but you still have support and structure that you might need. So you might be more able to ask for help, a little more independent with your meals. The structure isn't quite as needed when you're not in the program, but you still need that in order to help you with your struggles. The next level of care is called partial hospitalization or a day program, and that's where you're in a program all day long, but you're usually home at night or sometimes in the morning. So the idea is that you're able to practice eating a meal on your own or with supervision outside of the facility, but there's still a lot of structure and support that you need in terms of being in that program. Then there's residential. Residential care is 24/7, it's around the clock. Somebody usually stays in treatment for, I'd say, about 8 weeks or so, give or take. You have a whole team of professionals there to help. You've got nutritionists, therapists, medical doctors, and psychiatrists. And that's where you really need a lot of intense supervision and monitoring. Otherwise, you might act on your behaviors if you weren't there. The next level of care is hospital, where you have to go in and because you're medically unstable. That's usually very short term. You don't have a lot of therapy. If you're able to go to school, go to work, if you're missing a lot of those things, your psychological functioning, your level of depression and anxiety and those types of things, if they're really getting in the way of your functioning, then you're going to probably need a higher level of care until you're able to get back on track.